Good morning, Naledi, and to the SABC agenda viewers. Yes, we're coming to you live from Sun City. Let's welcome Dr. Letlape, who is going to talk to us about what's coming up today on the conference. Good morning, Dr. Letlape. Please talk to us about what is to be expected today at the conference.
What is to be expected today from the conference is we've decided that this is going to cease to be a talk shop. So whatever we're talking about, there has to be a program of action in terms of implementing what we have spoken about. Whatever we've diagnosed as the problem, it is now time to manage the problem, not to defer and talk about it at the next conference again.
Dr. Letlape, the minister yesterday talked about the crisis in human resources and looking at 2030 around the corner and the plans for universal health coverage. Are we on track? Is it still doable?
I agree with the minister. We have a crisis and it requires radical intervention. And part of the problem is a system problem. We got to totally reform the system to make it efficient. Jobs that are not necessary must be taken out. Jobs that are necessary need to be funded. Healthcare is a frontline activity, and we're tired of hearing that there's no money for posts. So posts have to be prioritized if we prioritize service provision. And that's the radical thing that needs to happen. So within the resource that we have, we've got to rearrange how we spend that money. We've got too much administration. If health is going to be better, it has to be a national competence. We only need one minister of health, not 10. And all those savings that will come from having one minister of health will ensure that we can fund capital infrastructure, equipment, and human resources.
The minister has also asked the regulators to intervene, especially what we have seen with the immigration of skills in the country, in the health sector. And he has asked you to kindly assist with this. Talk to us about that as regulators. Are you going to be on top of it post this conference?
We are on top of it. Our duty is to ensure that the training is appropriate. Our duty is to ensure that the practitioners we register are fit for purpose, and that we've always done. Employing them and retaining them is a function of the state. But the minister is correct. There's something that we can do in terms of advocacy. People will only be retained if posts are available, if posts are funded, and if working conditions are conducive, if they can earn a living. If they can be full-time healthcare professionals that do not need to moonlight to put food on the table, where people should be adequately remunerated to focus on their jobs. If you're in public service, you're in public service. If you're in private care, service, you're in private service. If you are a healthcare professional, you should be able to earn and support your family on the earnings of being a healthcare professional. That's how we're going to retain.
Dr. Letlape, this conference, and I asked this question to your Zimbabwean counterpart yesterday, comes at the backdrop of very sad news where we were told about a bogus doctor who has been practicing in the country and is accused of rape of minor children. Does this speak to loopholes in the registration system of doctors in the country, especially those who are coming from outside? Hence, we see these syndicates now taking chances, working in the country.
To the contrary, there are no loopholes in what the register does. It's a crisis of values in society. People need to remember, we register fully qualified, competent practitioners that uphold the oath. We do not register bogus doctors. It's members of society that become bogus doctors. Being a bogus doctor is an act of criminality. We do not register criminals. So it's a values crisis in society where people now masquerade as doctors. And part of the problem is that we don't have sufficient resources to deal with the criminals. Because when you are a bogus doctor, you are not registered with council. Council has no authority over you. But what we have done as regulators is to go out there, call the police, act with the police in exposing the bogus doctors. So we are going beyond the call of duty as regulators. So nothing could be further from the truth. We are pulling our weight and making our contribution in terms of eradicating bogus doctors. But it is a problem of a values crisis in society. And we can only stamp it out with the full cooperation of the public. Our duty, there are things that we can do better. Where we register practices, we say, this is the hallmark of a proper practice. If it doesn't have all these hallmarks, report it to council. So we need to ensure that the mandate of registering the practices becomes part of the mandate of the respective councils.
Dr. Letlape, thank you so much for talking to us. We look forward to chatting to you in the future before the end of the conference. That was AMCOA President Dr. Letlape.